very important topic when it comes to fertility is recurrent miscarriage, so let's talk about it. When an early miscarriage happens 3 or more times, it's called a recurrent miscarriage. These miscarriages do not have to happen one after another. They can sometimes have healthy pregnancies in between. Recurrent miscarriage affects around 1 in 100 women. There are a number of factors that make recurrent miscarriage more likely. So firstly, let's discuss genetic factors. The most common cause of one miscarriage or recurrent miscarriages are abnormal chromosomes. 1 in 2 miscarriages happen for this reason, and they're more common as you get older. In most cases, this can happen even if the parents have normal chromosomes. Lifestyle factors are also important. Being overweight or being underweight increases the chance of having a miscarriage. Cigarette smoking and drinking also increases your risk. Age. Now, the older you are, the more likely it is that you'll have one miscarriage or recurrent miscarriages. This is because as you get older, the egg quality declines. To give you an idea of this, so if the age of the mother is under 35, the risk of miscarriage is around 15%. However, if you're over 45, that risk goes up to 93%. Likewise, miscarriage is also more common if the father is above 40. Sometimes recurrent miscarriage is linked to blood clotting factors. Common one may be antiphospholipid syndrome, which increases your risk of forming blood clots. There can also be inherited blood clotting problems, which your doctor would investigate you for. Sometimes there may be structural reasons for recurrent miscarriage, and what I mean by this is an abnormality in the shape of the womb. There can also be hormonal reasons why miscarriage is more common. For example, diabetes. Now, if you have well-controlled diabetes, then this does not increase your risk of miscarriage, but if your diabetes is poorly controlled, then it does. Thyroid problems, so having well-controlled thyroid disease does not affect your risk, but having poorly controlled thyroid disease does. There may also be sperm factors, so if the father of the baby has abnormal sperm DNA, then this can also affect the risk of miscarriage. Sometimes we don't get to fully understand why recurrent miscarriage happens, and that can be quite hard for the patient to process. If you've had recurrent miscarriages, then there are investigations that we can offer that will look at the causes that I've just discussed to help identify what is the best for you.